And guys, if you do all these things, you can avoid some of these very common conditions in men. Doctor, would you please just go over these and tell us what you see here and which ones, oddly enough, which ones are showing a rise as we move forward?
From the screen, actually, we could see that heart disease and diabetes basically are some of the things that I see most often in the office. I mean, cancer as well, chronic respiratory diseases as well. Unintentional injuries, for the most part, in younger patients, perhaps, sport-related injuries, Alzheimer's, end stages of end of life, like in the early 70s, early 80s, influenza and pneumonia. Influenza in the influenza season and pneumonia, we normally try to recommend pneumonia vaccination in patients in their 60s. Kidney disease is associated with heart disease and diabetes as well. And suicide, we always screen patients, especially on their first visit, when it comes to depression screening to prevent suicide.
Some of the things you look for in testing as men get older, I would imagine you're looking at, and you talked about cholesterol, blood sugar, blood pressure. A lot of this is to do with the fact that there's a rise in diabetes. But what are some of the other things that you look for? As men get a little bit older, you're focusing in on these to try and help find ways to keep them healthy.
Correct. And stressing the importance of having a primary care physician is crucial because some of the things that we normally start looking into is the patient's weight. Is this an overweight versus an obese patient? Is this patient in the pre-hypertension or hypertension stage already? And at least on the first visit, when the patient comes to me, I normally do all those things. And then at least just a basic fasting lipid profile and a basic metabolic panel that we're looking into cholesterol and glucose levels. And at least early in life, as of 18 to about, I would say, 40 years of age is when we stress out a lot the importance of exercise to reduce weight, following on the blood pressure. And if there are abnormal, for instance, glucose levels or cholesterol profile, we want to make sure the patient enhances or engages into dietary changes and exercise to reduce glucose levels, which could be abnormal, and cholesterol profile levels, which could be abnormal, in order to prevent diabetes and heart disease later on in life.